Hi everyone, this is the AOA specialty video on general surgery. My name is Kristen Cox. I'm a fourth year medical student at the University of Washington, and I have applied for general surgery residency. So what are we going to talk about during this presentation? First is going to be the scope of practice, then why I chose general surgery, some details about residency, a timeline during medical school, elective rotations you might want to consider taking, what makes an application competitive, the letters of recommendation you will need, the fellowships available after completing a general surgery residency, and some resources you might want to check out. So, scope of practice. General surgery residency is really a gateway for many different types of practice that you could have as a surgeon. The first would be a classic general surgeon that does it all. These people take call where they might see a trauma or do acute care surgery, doing gallbladders and appies. And they'll do oncologic surgery with, lumpectomies or mastectomies, taking out colon cancers. And then depending on the specific practice setting, they might do some thoracic work removing lung cancers or do hepatobiliary with liver resections or Whipple's for pancreatic cancer. And then there's subspecialized surgeons. These are people that have completed gen surg residency and then done a fellowship. So they might be an endocrine surgeon, they might do plastics and reconstructive surgery. So a good example would be after the mastectomy for breast cancer, plastic surgeons will go in and do reconstructive work for the patient. Vascular surgeons, people specialize in oncologic surgery, whether it's the breast, colon, or hepatobiliary. Thoracic surgery, and surgical critical care, so working in the ICU primarily. So why I chose surgery. We've all heard that age-old comparison of, do you want to be in the clinic or the hospital? And then, do you like procedures? So for me, I definitely love being in the hospital. I love the acuity that you see, and I really love the collaborative environment that it creates with all the different services working together to care for complex patients. And I also love procedures. Another thing surgeons love is complex anatomy. You might hear them be described as goal-oriented, they want immediate gratification, or they're doers. They also work well under pressure, they think on their feet, and really for me, it was the fact that surgeons take the symptoms, the imaging, the labs, their own knowledge of pathophys, they come to a diagnosis, and then they do something about it. It's not always going to the OR, but there's definitely an action list of things we're going to try. Now for a timeline for medical students interested in general surgery. As a first and second year medical student, really just congrats on starting this entire process and enjoy this time. I know it can be stressful worrying about step scores, grades, creating the perfect application for the perfect residency program, but remember why you came to medicine in the first place and use this time to soak up the knowledge and information that your educators and mentors are sharing with you. What you can do, however, is get engaged in community service, leadership, and maybe research. The big caveat, though, is please only do the things that you truly get personal satisfaction from, not just something that will look good. And the reason I say this is because when you're on residency interviews and you're talking about the activities you are involved with, if you were passionate about it, it will come through in the way you describe your experiences and talk about it. And conversely, if you only did it to check a box, it's going to be obvious. So I personally love education and mentoring, and these are the types of programs I naturally gravitated towards. I was a tutor in undergrad and medical school. My med school also has a program that promotes health by promoting education. So I volunteered in a high school science class. And I also was involved with something completely unrelated to medicine called Girls on the Run, which is an after-school program for elementary aged girls that empowers them and tries to promote a healthy lifestyle. So once again, please only do the things you're passionate about. You'll be better off for it. Another really important thing would be career exploration. If you're already set on surgery, I highly, highly recommend you check out the other surgical subspecialties. Plastics, cardiothoracic, and vascular all have a path to following Gen Surg residency. You can complete fellowships in these fields, but they also have their own residency program you can apply directly into after med school. And so if you identify early on that this is where your passion lies, you might be better off applying directly into one of these integrated programs. ENT, also known as OTO, orthopedic surgery, and neurosurgery don't really have a traditional path after a Gen Surg residency. And so if you really wanted to do these fields, you would want to apply directly to them. As a third-year medical student, you should really just focus on your clerkships. For a Gen Surg application, your grades in surgery and internal medicine are going to be the most important. At the end of MS3 year is when you're going to want to ask or confirm who's going to be writing your letters of recommendation. Fourth year is really going to be all about the application process. In July, you're going to want to check in with your letter writers and make sure they have all the necessary information to write you a strong letter, strong being the key word here. They might need your CV, your personal statement, and or want to meet with you in person. In September, you'll submit your application via ERAS. This is the same program that just about every other type of residency will use. Late October to late January is going to be the interview season, with the bulk of your interviews clustered in November and December. In February, you will submit your rank list, and match day occurs in March, and you'll find out where you're going to go become a surgeon. Letters of recommendation. First, how many do you need? Well, you should aim for 4 at least. Most programs will require 3, however, some want 4. You might end up with more than 4 letters if, for example, one of your letter writers attended program X. They might write you a letter tailored to that program specifically, and then they might also write you a more generic letter that could be sent to the remaining programs. The other piece of advice would be to follow the requirements listed on each program's website to a T. If the program says letters of recommendation 3, only send them 3. If they give you a range, then maybe 3 to 4 letters, consider how strong your 4th letter is. If it's not the strongest, maybe you did not work with this person all that much, consider sending only your 3 strongest letters. However, if all 4 are very strong, then by all means give the program 4. Who should the letters be from? Well, if you're applying to a general surgery residency, you should get letters from surgeons. You don't absolutely have to have them from all general surgeons, but if the opportunity arises, you might want to choose that. You'll need one from a chair/department head, and your school will have a system in place on how they go about formulating these letters. You'll also need a, quote, big name person as a letter writer. This is likely a full professor or someone well known within their field. This could very well be your chair letter if you worked with them enough that they can speak to your character and competency. The remaining 2 letters really need to be from people that know you well. They can talk about your character, your ability to work in a team, your skills, and really just paint the picture of who you are as a person and why this program would want you to join it. For electives, required will be a general surgery sub-internship or acting internship. Those are just the 2 different names that schools will give the same thing. The encouraged and consider electives I have listed are not at all necessary for a successful application, but rather they can help you be successful as an intern. So I would encourage you to do an ICU rotation, either trauma or surgical. You could do a radiology elective. Surgeons really need to know how to read their own films and create a surgical plan from them, so that could be a helpful elective. Anesthesia, the anesthesia provider is a partner of ours in the OR, and it could be helpful for you to see what they are taking care of and experiencing on the other side of the curtain. And then GI would be great for Gen Surg. You could also consider plastic surgery, hem-onc, infectious disease, and pulmonology. Obviously, you won't have time for all of these, so really just pick what you're most interested in. What makes an applicant competitive? Well, they have strong leadership. They have good clerkship grades, specifically in surgery and internal medicine. They really care about community service. They have strong Step 1 and Step 2 scores. They might be engaged in research. And they're personable. This is going to come through in your letters of recommendation, in your comments that go along with your clerkship grades, and then how you engage and interact with people at the interview day itself. And I think what's important to tie in here is your hobbies. It might seem silly to list hobbies as important in an application, but that's how we connect with people and get to know them outside of, how good can you tie a one-handed knot. There were a fair number of my interviews where we talked about shared hobbies and interests, and that's how they got to know me better. I also want to point out the fact that I did not list all of these programs in order of any sort of importance. They're in this web-like configuration on purpose. No single item here is absolutely the most important. It's a combination of all of these, and it's a different combination for each applicant that makes them successful. Now, details on Gen Surg residency. The length is 5 to 7 years. The shortest at all is 5. The reason it's a range is because most academic programs are moving towards either a highly encouraged, if not required, 1 to 2 years of research. Sometimes people even do 3 years. So that's why, add 1 to 2, it could turn into 6 or 7 years of training. The application itself is via ERAS. There's no special requirements, no special match system. It's like the vast majority of other programs. So now I want to show you some data from the 2019 match. It's available on the NRMP website. And the reason I'm showing you this is to show you how many positions are available for each different type of specialty. And I'm not showing you these numbers to, quote, scare you, but rather just to show you what is out there and sort of compare how many positions each field has. So the first column on the far left is the program field. The second column is how many positions are available, followed by how many were filled. And the far right column is how many spots remained unfilled, so how many open spots were left over. So I'm going to highlight the surgical specialties and then also some others that you guys might be interested in. If you aren't 100% set on surgery, but it's maybe on your list, I put some others in too. So, anesthesia and emergency medicine are often thought of when people consider other ideas for Gen Surg. Internal medicine has over 8,000 positions. And then if we contrast that with neurosurgery that only has 232 spots and all but one was filled, this is a specialty that you would want to explore early on and see if maybe it's something you want to do so that, relatively early in your career as a med student, you could be tailoring your experiences towards a successful application here. And then let's look at the second half of the list. We have Oto and plastics, similarly with 328, 172 spots. Both program types, all of the spots were filled. So once again, you'd want to identify these early on. There are plenty of people that want to go in these fields and are successful and match. So by all means, if this is your passion, you can achieve it. You just need to identify it earlier on. Surgery, the yellow and the blue, categorical versus prelim. So a prelim position is a 1-year position only. The people that fill these spots might be people that recognize they wanted to do plastics or oto a little bit late in the game. And so they're going to do a prelim position and then apply to those fields the following year. They might also be folks that want to do regular gen surge, which is the categorical in yellow. That's the traditional 5 to 7 I was talking about earlier. But either they recognized late that was what they wanted, or they didn't have the strongest application, so they're doing a prelim position and then will apply to categorical. So the fellowships that are available after general surgery residency, there's quite a few actually. So the 1-year fellowships include colorectal, transplant, MIS, which is basically foregut surgery, so doing lower esophageal surgeries, doing gastric surgery for cancer, doing hernia surgery, bariatric surgery, and the such, breast oncology, endocrine surgery. The 1 to 2 years, depending on where the fellowship is at, like the institution itself, are surgical crit care and burns. 2-year fellowships include pediatrics, surgical oncology, vascular, and plastics. And then thoracic is either 2 to 3 years, depending on the institution. Some resources you might want to check out. First and foremost would be your school's surgery advisor. They really know the nuts and bolts of the system. They know the specifics for students from your institution, the challenges and triumphs they've had. So highly, highly recommend reaching out to them, and as early as you can once you recognize surgery as an interest. Then the American College of Surgeons. This link I put in goes specifically for med students, and it talks about the different specialties within surgery. The American Medical Association, this one's more general. Maybe you aren't quite sure yet if surgery is right for you, and this can help you identify your goals, your passions, reflect on the things that might be important to you when choosing a career. The NRMP, the match, this will take you to the site where I found the data on the various program number of spots, as well as some other information on it. And then the Association of Women Surgeons. They are really working hard to sort of get rid of that notion or stereotype that if you want to be a woman in surgery, you would have to give up a life or you wouldn't be able to have a family. And so they're working hard with attendings, residents, and medical students to create mentorship opportunities and really foster a community of support. So highly encourage you guys check out any of these that sound good to you. And then also, as a disclaimer, this whole presentation is an N of 1. I am one medical student. This is my opinion based on my experiences, the advice I have gotten from others. If you are interested in surgery, I highly, highly recommend you talk to your colleagues, see what they think about surgery, why they are choosing it or not choosing it. Residents at your institution that are in surgical programs, you talk to them about what they love and what they dislike and the challenges they might have faced. And then your advisors and mentors. We really pick our specialty based on great mentorship, and so I really encourage you to seek that out. Thank you guys. Take care.